So what is Morpheus? Morpheus is kind of this next technology. Remember, all morning we've been talking about individual devices and platforms and all of the technologies on those devices. Right now, we're going to spend an hour or a little bit more talking specifically about a technology, because this technology spans most of these devices, and it's on most of them, and it's one of our most popular technologies. So we're going to dedicate an entire lecture to the Morpheus8. It is radio frequency microneedling. We have the opportunity to go up to 7 millimeters in treatment depth. So you as a practitioner or as a provider, you get the chance to select how deep you want to treat. The reason why that matters is for us, as providers, we get an unbelievable amount of opportunity. We can treat superficial texture. We can treat deep and melt fat. We get to pick all that. That's also the daunting side of this, because trying to put this all in a box and wrap it up and put a pretty little bow on it and give you treatment parameters is really frustrating for a lot of users. Because it's like, I hear this every day. It's like, well, my trainer said da-da-da-da-da-da, or InMode said da-da-da. It's like, well, yes, but contextually that is for this. We're talking about this, totally different things, right? So it's a powerful tool that is very versatile. And the biggest and quickest way that you can snuff it out is stick to treatment parameters. When you just have a very locked and loaded set of treatment parameters, you're doing one treatment with a device that can do 1 million treatments. And that's what I found myself the first 2 years of using Morpheus. Everyone is getting the same treatment. 4, 3, 2, 1, or whatever it is. And everyone's getting the same treatment, and stacked it, and the depths, and the double pass. It was just, everyone was locked and loaded, same treatment. And I was just either way over treating, way under treating, inappropriately treating, and I was fitting everyone in the same box. But now with more time and maturity and this device in my hands and more reps, as I like to say, now I truly understand why I'm doing what I'm doing. I understand why I'm at a 4 millimeter depth, or why I'm at a 3, or why I'm double stacking, or why I'm a 40 kilojoule energy versus a 20. So we're going to unpack a few of those things, and we're going to understand the why. That way, when you get to your patient, you're looking at your patients from a anatomical perspective, understanding their goals. You're like, hey, this is why I want to treat this in this fashion, in this way. That's what I hope we can kind of start to unpack for you guys through this lecture. And I know that's a little bit deeper. If you're just considering Morpheus, my apologies, but like you saw hands raised this morning, like most of the people in here have it, so they appreciate that type of lecture. But if we're getting into the weeds, just hang with us. So the Morpheus microneedle radio frequency would be the opportunity to go all the way to a 7 millimeter treatment depth. We get to select that depth. You can use it most anywhere that makes sense in the body with multiple different types of tips for our hand pieces. Hang with me. This is a little messy. I'm going to clean it up with a table. But on these tips, we get a choice to choose, we get the opportunity to choose which tip we are utilizing for a specific purpose. We'll walk through each one of these. And then we have 2 different hand pieces. We have a Morpheus body, as the name would indicate, that is designed for larger body areas. And we have our regular Morpheus. Our regular Morpheus is what accepts the multiple different tips. If that was confusing, hang with me. We'll get to a table that'll make sense. Okay, I alluded to this earlier in the morning, but this is safe on most skin types. Now, I will say carefully from the mic, you can treat darker skin types. InMode would have a cow if I said to treat 5s and 6s, but I have pictures of 5s and 6s. You just have to go low and slow.